Hi, I'm Dr. Leslie Memsic. I'm a surgical oncologist in Beverly Hills and a specialist in breast. I'm going to speak to you today about treatment for breast cancer. The two most common treatments for breast cancer include lumpectomy, where the cancer is removed but the rest of the breast is left intact, versus mastectomy, where the entire breast is removed. Luckily, the vast majority of all women who present with breast cancer can be treated with lumpectomy alone. This means you remove the lump with a rim of normal tissue, that's called margins, just to confirm that every little piece of cancer has been removed. In case there's any tentacles, they're removed as well. And then post-operatively, even though you'd think that removing the cancer with clear margins would be adequate, we have learned that you need radiation in situations where you remove the cancer by lumpectomy alone, because the rest of the breast does have increased risk of developing a second malignancy. Specifically, it's about 30% of women within 10 years without radiation after lumpectomy alone will develop a second primary. So lumpectomy, you remove the lump with clear margins and then you receive radiation. And generally, the cosmetic results are excellent. Mastectomy is removal of the entire breast, with or without the nipple. Most commonly nowadays, we are saving the entire skin envelope of the breast, including the nipple. And so you have an excellent cosmetic result even after removal of the entire breast. The indications for removal of the entire breast include multifocal cancers. That is to say, if a woman has more than one cancer in her breast, in different areas of the breast, that would suggest that that breast needs to go. The second reason would be if it was a very large tumor, a very large cancer, and that doing a breast preserving operation in which you remove the cancer alone but leave the breast would leave a very poor cosmetic result. In those situations, a woman has a better cosmetic result by removing the breast and reconstructing the breast rather than preserving only a small part of her own. If a patient cannot have radiation, for instance, maybe they had radiation as a youth for Hodgkin's disease to the chest, for instance, then we would not recommend a lumpectomy because there's a very high risk of recurrence after lumpectomy alone in the absence of radiation. So in those women who would like to undergo a lumpectomy and otherwise are a good candidate, but cannot receive radiation therapy, we would recommend a mastectomy with reconstruction. The other case in which patients should receive mastectomy instead of lumpectomy are those women that carry the BRCA1 or 2 genes. Those are genes which actually are not common within the breast cancer population, but in those women who do carry the BRCA1 or 2 gene, that gives them a very high chance of developing breast cancer in both breasts. Therefore, in this very select group of women, we recommend that they remove the opposite breast, the uninvolved cancer breast, as well, prophylactically, because they have such a high risk of developing breast cancer in both breasts. The only other reason to remove your breast, mastectomy, if you're otherwise a good candidate for a lumpectomy, is because it's personal choice. There are some women that have very high risks for developing breast cancer. They may have seen their mother die of breast cancer when they were young. They have very dense breasts, which make it very difficult for surveillance, meaning to follow their breasts, to make sure they don't develop another breast cancer or a second primary. And in those women, it just may make more sense for them mentally if they remove the breast completely. And in those women, frequently they'll remove the other breast as well, just to minimize their risk of developing breast cancer in either breast, even though they may be a candidate for a lesser procedure. First thing to do, if you feel a lump in your breast, or if you're told you have an abnormal mammogram, is take a deep breath and relax.